السلام عليكم ورحمة الله وبركاته. Today, السلام عليكم ورحمة الله وبركاته. اليوم إن شاء الله راح نبدي محاضرتنا as a principle of drug therapy. راح أعطيكم إياها دكتورة أسماء من فرع الأدوية. إن شاء الله راح أكمل وياكم محاضرات هذا الكورس. إحنا أخذتوا بالبداية أنتوا الانترودكشن to pharmacology. عرفنا شنو الفارماكولوجي and as we said this is an important topic you will depend on for this year and inshallah for the next year also you will take pharmacology. Today we are going to speak about the principle of a drug therapy. Firstly, we will speaking about pharmacology and what is pharmacology as a term, from where it's taken. They divided pharmacology as a term to two types: pharmakon, which is used drug as a drug in Greek in the past, and logi is the science. So pharmacology is the science that study the effect of chemicals, a drug on living tissue. This is just for your information. In general, pharmacology divided to two parts. And this is what we focus on in pharmacological science. So pharmacology, it will study pharmacokinetics and pharmacodynamics of drugs. And we're speaking and explain what is pharmacokinetic and pharmacodynamic in this course. For pharmacokinetics, what is will be discussed in this lectures, it means what the body does to the drug. Okay, what the body does to the drug. Whereas pharmacodynamic means what the drug does to the body. We're going to speak firstly about pharmacokinetic, as we said, which is what the body does to the drug. Pharmacokinetic divided to four important processes, which is absorption, distribution, metabolism, and finally excretion. Okay. And as we said, pharmacodynamic means what the drug does to the body. And also in pharmacodynamic, we study the mechanism of action of pharmacological effects of drugs. And this is what we focus about in this course. Mechanism of action of pharmacological effects, interactions between drugs, and all addition to the side effect and adverse effects of drugs. Firstly, we'll talking about pharmacokinetic of drugs, as we say, and it is, as we said before in the first slide, it is divided to four important processes, which is firstly the absorption. When a drug absorption from the site of administration in any route permit entry of the therapeutic agent into plasma. Okay, the drug absorbed, then what happened? Second, the drug may then reversibly leave the bloodstream and distribute into the interstitial and intercellular fluid, and here the drug will distribute inside the body, which is called this process distribution. After that, or in the same thing, the drug metabolized, could be in liver, kidney, or other tissue. This is called metabolism. Then finally, the drug metabolized are removed. The drug and its metabolized are removed from the body, put in urine, bile, or feces. All this process could happen in one time, okay, in order. This is what happened to the drug when entered to the body. This is the process of pharmacokinetic, okay? This graph show or schematic representation of a drug after the drug absorbed, after taken in any site of administration, could be orally, injection, then absorbed. Then the drug go to the plasma, which is called distribution. The drug distribute in our body. Then it will undergo metabolism, and the drug and its metabolites will be elimination through urine, bile, or feces. Okay. Now we speaking about pharmacokinetic, and as we say, which is referred to what the body does to the drug, and also speaking a little about pharmacodynamic. We explain the definition of it, which is what the drug do to our body, and the four processes of pharmacokinetic. Actually, the route of administration is different from the different route of administration we have, and all the route of administration determined by properties of a drug. For example, could be this drug water soluble or lipid soluble, ionization. Also, by therapeutic object. For example, when we administer the drug to the patient or the volunteer extra, do we need rapid on it, and the need for long-term treatment or restriction of delivery to a local site? Actually, major routes of drug administration include internal, parenteral, topic, and among the others. Okay, and we have different kinds of route of administration. And there is also, before we determine what route of administration will be given to our patient, we have to know some factors that will affect the route of or the choice of route of administration. Firstly, physical and chemical properties of drugs, and I would say could be lipid soluble, water soluble, ionization of the drug, the site of desired actions. What is the site of desired action in the body? Rate and extent of absorption from different routes. Effect of digestive juice and first pass metabolism on the drugs. We will talking about this in the next cultures. Rapidity with which the response is desired. Do we need the response honest or long duration of treatment? Accuracy of dosage required, and the condition of patient. All these factors will affect the choice of route of administrations of drugs. Okay, what this route of administrations? We have different route of administration, and this diagram will classify the route of administrations, which is divided to systemic and local. Systemic route of administration subdivided to two parts: internal, such as orally, sublingual, or rectal, and parenteral. Parenteral, that means injection. For example, intravenous, intramuscle, subcutaneous, intraarterial, and in addition to parenteral and transdermal. The other route of our classified of administration is locally, such as skin topical, intranasal, ocular drops, mucosal, throat, vagina, mouth, ear, and in addition to inhalation and transdermal. And here, as we say, see, inhalation and transdermal could be local route of administration and the parenteral route of administrations. Here also, this figure also shows the internal route, that's what we will speaking about, and explain briefly. The oral internal route divided to oral and sublingual here in the mouth, and could be rectal route, okay, such as suppositories for children's. So, for internal route, internal administration, which is administer a drug by mouth, is the most common, convenient, and economical method of a drug administration. The kind of a drug here in this slide could be swallowed, allowing oral delivery, or it may be placed under the tongue, which is called sublingual, or between the gums and cheek, which is called buccal, facilitating direct absorption into the bloodstream. This route divided as oral route, as we say. Oral administration provide many advantages. Oral drugs are easily self-administered. Toxicity and or overdose of a drug may be overcome with antidote, such as activated charcoal, low gastric pH inactivates some drugs in this role. Okay, this is one of the disadvantages. A wide range of oral properties is available, including enterocotic and extended release preparation. Okay, so there is advantage and disadvantage in each route. Okay, there is no a perfect route of administrations. For oral route, as it is available in enterocotic and extended release preparation, we're speaking about it. Enterocotic preparation, which is a chemical envelope that protects some drug from stomach acid. This is what the aim of the use this type of. Delivering it instead to the less acidic intestine, where the coating dissolves and releases the drug. It is useful for certain drugs, for example, omeprazole that are acid labeled, and for drugs that are irritating to the stomach, such as aspirin. Another kind of which is extended release preparation, and the abbreviated in XR, XL, XR. Medication have a special here. The medication have a special coating or an ingredient that control drug release therapy, allowing for slower absorption and prolonged duration of actions. In addition, extended release formulation may maintain concentration with the therapeutic range over a longer duration. Okay. As what else, which is as opposed to immediate release dosage form, which may result in large peaks and trough in plasma concentration. Okay. ER formulation are advantage for a drug which with short half-life. For example, morphine is 2 to 4 hours, and it must be administered 6 times daily to provide continuous pain relief. However, only 2 doses are needed when extended release tablets are used. For the other kind of administration, which is sublingual or buccal, this route involves placement of a drug under the tongue. The buccal route, which is between the cheek and the tongue, involve placement of a drug between the cheek and gum. Both the sublingual and buccal routes of absorption have several advantages, include ease of administration, rapid absorption, bypass of harsh gastrointestinal environment, and avoidance of first pass metabolism. So this is the advantage of sublingual or buccal routes. As we say, there is advantage and also disadvantage of each route. This figure summarizes what we're talking about, which is route of administration, internal, for sublingual here, which is a placement under the tongue, allows the drug to diffuse into the capillaries and therefore to enter the systemic circulation. The advantage, the drug bypass the intestine and liver and thus avoid the first pass metabolism. Okay. For parenteral route, there are different kinds of parenteral route. Could be injections such as IM, which is intramuscular, or SC, abbreviated for subcutaneous injection, and IV for intravascular injections. Okay. For parenteral route, the parenteral route introduces drugs directly into the systemic circulation, is used for drugs that are poorly absorbed from the GI tract, for example, heparin, or unstable in the GI tract, for example, insulin. It is also used for patients unable to take oral medication. Could be unconscious patients, or in circumstances that require a rapid onset of injection, or patients such as patients in urgent cases. Parenteral administration provides the most control over the dose of the drug delivered to the body. So all the dose or all the concentration that given in this route could be go to the body to the of the patient and distribute in the plasma tissue. However, this route of administration is irreversible and may cause pain, fear, local tissue damage, and infections. The four major parenteral routes are intravascular, intravenous, or intraarterial, intramuscular, which is IM, subcutaneous, and intradermal. Each route of administrations have a different kind of advantage and disadvantage, and I think in the lab we will know how we differentiate between each route of administrations. Okay, for IV or intravenous, IV injection is the most common parenteral route. It is useful for drugs that are not absorbed orally, such as a neuromuscular blocker. IV delivery permits rapid effect of a maximum degree control over the amount of drug delivered. The full amount of drug is delivered to the system circulation almost immediately. Peak plasma concentration and increased duration of circulating drugs. Another kind of route of administration, which is intravascular route, IM, intramuscular route. A drug administered IM can be in aqueous solution, which are absorbed rapidly. Preparation which are absorbed slowly. Depot preparation often consists of a suspension of a drug in non-aqueous vehicles such as polyethylene glycol. As the vehicle diffuses out of the muscle, drugs participate at the site of injection. The drug then dissolves slowly, providing a sustained dose over an extended interval. So this route IV, it is rapid than IM injections, okay, which is the rapid route of administration, or give us the rapid effect rather than IM route. Okay. In the next slide, we'll speaking about the other route, which is internal injections, such as subcutaneous. Subcutaneous route, like IM injections, provide absorption via simple diffusion and is slower than IV route. It's slower than IV route. Injection minimizes the risk of hemolysis or thrombosis associated with IV injection and maybe provide constant, slow, and sustained effect. This route should not be used with the drugs that cause tissue irritation because of severe pain, and necrosis may occur in some cases. For intradermal IV, the intradermal route involves injection into the dermis, the more vascular layer of skin under the epidermis. Agents for diagnostic determination and desensitization are usually administered by this route. Some route of injection could be given in this route. And here this graph also, or this picture, sorry, classify the different routes of injections and how we inject for intravenous and look the angle of the needle, and for intradermal, for intramuscular, which go directly in 90% degree of angle, and for subcutaneous route. And this schematic representation of subcutaneous and intramuscular, also for intravenous and intradermal route for internal injections. As we say, there is advantage here. This figure summarizes what we speaking before. For parenteral route, advantage which could be fast, the bioavailability 100%, suitable for a drug not absorbed by the gut. For IV can deliver continuous medication, for example, for morphine for patient in continuous pain, or saline drip for people needing fluid. The disadvantage of this route, more risk of addiction when it comes to injecting drugs of abuse. Pilonophobia, which is the fear of needles and injections, especially for children. If needles are shared, there is risk of HIV and other infectious disease. It is the most dangerous route for administration. If not done properly, potentially fatal air pollutants can occur, and that's what will be indicated in some hospital if the nurse has no experience or skill for inject. And also need for restrict asepsis. This is the advantage and disadvantage for parenteral route in general. Okay. Others routes such as inhalation and nasal preparation, both the oral inhalation and nasal route of administration provide rapid delivery of a drug across the large surface area of mucous membrane of the respiratory tract and pulmonary epithelium. Drug effect are in this route almost as rapid as those with IV bolus, drugs that are gases, for example, anesthetic drugs, and those that can be dispersed in an aerosol are administered via inhalation. The nasal route involves topical administration of the drugs directly into the nose, and it's often used for patients with allergic rhinitis. Intrathecal and intraventricular route. Here, the blood-brain barrier typically delays or prevents the absorption of drugs into the central nervous system. When local rapid effects are needed, it is necessary to introduce drugs directly into the cerebrospinal fluid, and that's why we will need sometimes for intrathecal route. So this is what we have about route of administration in briefly. I hope you understand, and any questions, I'm ready. You can send me a question on the classroom, and I'm happy to answer all the questions, and good luck for you. Thank you so much for listening. Yeah,